Hi guys, your wellness coach Margaret speaking from Wilma Well. I hope everybody's doing good, and today we're going to talk about blood pressure, high blood pressure, and how do you know you have high blood pressure, and what can you do to lower your blood pressure? The first thing you know, in order to know you have high blood pressure, you have to test yourself. You can find out you have high blood pressure if you go to your doctor visit, or maybe employee annual screening. That can tell you if you have high blood pressure. And so once you have high blood pressure, just one measurement does not determine that you have high blood pressure. You can, when you go to your doctor visit, if they check your blood pressure is high, the doctor might tell you, if it's not severe, they might tell you to keep monitoring it by changing your lifestyle. You go home, you eat healthy, you stop smoking, you exercise every day, and also more plant-based food or diet. And also reduce stress. So those are the doctor will tell you, those are the lifestyle changes that you can do to lower your blood pressure. And so what about if your blood pressure is high, like 180 over 120? That is severe blood pressure, which can cause what they call hypertensive crisis. So that one you need to call 911, or if it's in your doctor office, they can either treat you there or send you to emergency room so they control that blood pressure. And again, majority of people have blood pressure and they do not know if they have it, and that's why we call blood pressure is a silent killer. So the only time you know is only if you check it. You might have high blood pressure and you don't check, and you're not gonna know if you have high blood pressure. It's a silent killer. And so that's why if you feel like sick, or if you have like a blood pressure measurement at home, check your blood pressure often, or if you go to your doctor's office. And if you have it, you're going to change your lifestyle, you're going to eat healthy. And I know most of the time, once you have high blood pressure, the doctor will tell you, take your medication. Most of the time, medication alone cannot cure your blood pressure. You have to change your lifestyle. Just because you're taking medication does not determine that you're gonna cure your blood pressure. So you have to change your lifestyle. You have to lower you have to exercise. You have to stop eating certain kind of food or certain lifestyle. Stop smoking. Stop stress level. You gotta find a way to lower those things. And also you just want to make sure that you eat healthy, mostly plant-based nutrition. As shown, there's so much study has been done on plant-based diet and hypertension. So most people that eat, or vegetarian that eat plant-based diet, they have lower risk of they have less risk of hypertension. So plant-based food lower blood pressure, I think, because of the nutrient that is in there, alkaline, that in there, not much too much animal product. So if you have high blood pressure, you want to lower your animal intake, and that can help you lower animal intake and eat more fruits and vegetables. And also there are so many food that has high content of potassium. So you want to eat more potassium food. And if you look at the list of the potassium food, you Google it online, you will see that plants have more potassium food than animal products. And again, when you're checking your blood pressure, you want to make sure that you sit down. If you were exercising, you want to stay at least 30 minutes, wait, and check your blood pressure after 30 minutes. If you were smoking, you gotta stop that 30 minutes. Anything that you are doing which is vigorous, you want to stop that at least for 30 minutes. Sit down and relax, and that's when you check your blood pressure. And when you check your blood pressure, you sit in a chair, and then you want to make sure, mostly in a table, and make sure your hand is like on your above your heart level, on your heart level. So make sure you have a blood pressure cuff is fit your upper arm, because that's what you're going to use to measure your blood pressure. And before you check it, you sit down 5 minutes, relax, take a deep breath, Do not talk until you finish checking your blood pressure. Again, to be consistent with your blood pressure check, you can do 1 minute blood pressure check, which is you can check your blood pressure and take the average. So there's a blood pressure that you can run it, automatic blood pressure can run 3 times, or regular blood pressure manual, you can run it 3 times and take the average of that. You plus those 3 numbers and average it, and that can tell you one minute blood pressure check. So again, in order to lower your blood pressure, to avoid more chronic conditions such as heart disease and stroke and also blood clot, you want to make sure that you eat more potassium-rich food such as spinach. Spinach has like 540 milligrams of potassium, celery, avocado, watermelon, pomegranate, mushrooms. So there's several cucumber. There's several plant food that has very high amount of vitamin potassium, high amount of mineral potassium, which can help you lower your blood pressure. And again, stress, lifestyle changes is very important. Stress, reduce your stress level. If you're overweight, exercise to lose that weight, or if you have to change your diet, you have to change your diet to be able to lose that weight. And average age between 20 to older in the United States have high blood pressure. And maybe 54, the study has shown that 54% of those have controlled blood pressure. 17%, they even have undiagnosed blood pressure, which means they don't even know they have it and they have the high blood pressure. So you just want to make sure that you follow up with your doctor visit, take your medication if you are taking medication for blood pressure. And the main thing is your lifestyle gotta change. Stress level gotta go down. Watch what you eat. More plant-based, more vegetable, more fruits than animal product. You wanna reduce animal products. You wanna reduce oil intakes and stress down. You wanna put more of your time on a positive attitude. You don't want things that can give you more stress. And also sleeping, very important that you wanna sleep, get enough sleep, at least 6 to 8 hours. That's enough for some people. Some people might do 4 hours because of the work habits that we have, because the world has changed, so we have to feed our family, and some people sleep 4 hours. But again, you want to at least sleep for 6 to 8 hours is a little bit better. And also, if you have any other question, guys, you can visit to our website, wilmawell.com. And also we have one-on-one coaching to help you be able to control your high blood pressure, and also educate you on what kind of food you can eat and what you can do to be able to prevent this chronic disease, or to be able to help you control your blood pressure. And also we do education in medication education, how to take your medication and things like that. So I hope this can help for those people who have doubt on how to control their blood pressure. Another best way to be able to monitor your blood pressure and be consistent is by checking your blood pressure at home. Have the readings and write them consistently. Every time you check your blood pressure, write it down. And so when you go to your doctor's office, you can compare your blood pressure at doctor's office. The reason beyond this is because some people have what they call white coat syndrome. When you go to your doctor's office or any nursing office, you start panicking, your blood pressure goes up. So when you go to your doctor's office, if you already have your reading at home, you're going to compare that and you say, hey doc, look at my blood pressure at home. When on my comfort zone at home, it's normal, but when I come to your office, it's high. So that can make it easy for the doctor to be able to control your blood pressure. So I hope this helped. Your wellness coach, Margaret. Stay blessed. Have a blessed day. Bye.